Hi guys, I'm going to talk about ganglions and golfer's elbow. Ganglion cyst. Ganglion cyst is a benign cyst which is not a malignant cyst first. It is filled with glycerin and viscous fluid. It is not a cancerous first and it will not spread and does not cause any harm for the patients, which it is arise from the leakage of synovial fluid from the joint or tendon sheath. Sometimes it can put pressure on the nerve. It create a problem for the patients sometimes, and it is usually appear on anywhere of the body, over the shoulder, over the knee, and also inside the bone itself. Coming to the etiology is unknown, traumatic, and the mucus cyst associated with OA of DIP joint, distal interphalangeal joint. Then pathology. Pathology is multiloculated outer wall, several layer of collagen layer, and few are fibroblasts and mesenchymal cells, and then there is no synovial lining. And clinical features. It is well defined, translaminated cyst or non-tender. Old patients, painless lump. In old patients, it is cyst, mucus cyst, and then it is more common in women, some of young adults at such a period. The most common ganglion is dorsal carpi ganglion, where it is originated from the scapholunate ligament. It is asymptomatic usually, and then sometimes it increase and decrease in size. It may associate with aching pain and tenderness. There are two types of ganglion in the dorsal carpal ganglion. What are they? Onculent and then large ganglion. Onculent is pressure on the posterior of interosseous nerve, and then the large is pressure on the radial nerve. This is the dorsal carpal ganglion. The second most common type of ganglion is volar carpal ganglion, where it is originated from the FCR tendon sheath. Flexor carpi radialis are articulate between the radius scaphoid 2/3 and the scaphoid trapezium 1/3. It is located between the radial nerve and FCR tendon sheath. And in this treatment, there is no aspiration is not recommended for the volar carpal volar carpal ganglion. And then the volar retinacular ganglion is occur at 7 to 12% by flame mobile using. Complication of ganglion is infection, instability, neurovascular surgery, and decreased motion. These are the complication of ganglion. Golfer's elbow. It is caused by the pain and inflammation. The contact the elbow to the forearm to the elbow is from the, and then it forms tendinitis. It causes usually the repetitive flexing and the gripping and the swinging causes the pulse or thinning tears in the tendons. Repetitive hand and wrist forearm motions overusing, because using the more and more times we can get the golfer's elbows like this on the wrong way. What are the risk factors? Are above 30 ages, obese, smokers. And the clinical features are pain in medial area of elbow joints, tenderness, spasm, stiffiness, pain of movement in the wrist and elbow joints. Investigations are X-ray and MRI. The treatments, there are two types of conservation 1 and the conservation 2. The analgesic multivitamin, analgesic ointment, physiotherapy, rest, splint, bracing. The conservation 2 is steroid injection and the rest and the physiotherapy. The surgical treatments also recommended here. The surgical stitching, tightening of the ligaments, tendons.